Do you or your yoga students suffer with low back or sacral pain, or have been diagnosed with SI joint dysfunction and told your SI joint is injured, inflamed, hypermobile, or stuck? The truth is, unless you've been in a high-impact car crash or fall serious enough to fracture your pelvis, the SI joint is fine and not the cause of pain. SI joint dysfunction is one of the biggest myths in modern medicine. I was recently engaged in a conversation where a yoga teacher trainer told a student that was experiencing sacral pain that her SI joint could rip apart. I knew this to be untrue. It's a tiny joint barely able to move and extremely stable. It's reinforced by some of the strongest ligaments in the body. But I'm grateful for the conversation as it led me to do a deep dive into the medical studies, and I found some incredible and unexpected things that validate my own clinical experience. SI joint pain does not come from the SI joint. Let me explain. The SI joints are basically tiny shock absorbers between the sacrum and the ilium bones that transfer loads between the upper and the lower body. They can only move about 2 to 4 degrees and 2 to 4 millimeters on average. SI joint dislocation without concurrent pelvic fractures is extremely rare. The only way this tiny but mighty joint gets dislocated is in car crashes or falls from heights with enough impact force to also fracture the pelvis. So the good news is, no one is going to rip apart their SI joint doing yoga or any other movement or exercise practice. Also, SI joints don't get stuck and they don't become hypermobile. These are assumptions and guesses, often dressed up as diagnoses when someone feels pain in or near the SI joint. Researchers have shown in medical studies that there is no correlation between SI joint movement and pain. When movement was measured accurately with radiostereometric analysis, this is a stereo X-ray technique to measure micro movements of bone and implants, the researchers found there was no SI joint movement difference on the symptomatic versus asymptomatic joints of the pain sufferers. They also showed that during clinical movement tests for the SI joint, the assumed motion does not actually occur. And again, there was no difference between the symptomatic and asymptomatic joints. The clinicians are just fooling themselves with inaccurate visual assessments in these tests. And regarding pregnant women and SI joint pain, the studies found that pregnant women with moderate or severe pelvic pain have the same SI joint laxity as pregnant women with no pain or mild pain. So much for the hypermobile joint from pregnancy theory. The medical science is clear. SI joint movement has nothing to do with SI joint pain. So if the pain is not from the joint, what is it from? The reality is, most SI joint pain is referred from trigger points in the stabilizing muscles of the lumbar spine and pelvis, most notably the quadratus lumborum and glutes. Trigger points are small areas of metabolic stagnation in muscle fibers that refer pain. They send pain to a different place than where they live. And this fools almost everybody. The quadratus lumborum and glute medius and maximus commonly refer pain to the SI joint area. All symptoms associated with SI joint dysfunction are produced by trigger points in these muscles. When clinicians are not aware of muscle trigger point referral, they will always look for dysfunction in the joint underlying the pain referral, and they will have a hard time solving the pain because they misunderstand the actual sources of pain. As a neuromuscular trigger point therapist and yoga teacher, I've helped many clients and students solve their SI joint pain over the last 12 years because I understand that most bodily pain is referred from trigger points in muscles, even when the pain feels like it's in a joint. You can use the same methods to help yourself. Here's an example of self-myofascial release using compression, contract, relax, stretching, and vibration. This treats trigger points of the quadratus lumborum and glutes minimus and medius, which cause most SI joint area pain. I'm going to show you a quick way of how to actually treat those muscles that cause that low back sacral SI joint area pain. I'm going to show you how to do it with ball compression, contract, relax, stretching, and vibration. So I'm going to start with the QL muscle. This is a muscle that you can access from a side lying position with say if I'm treating for like right side SI joint, or if you feel more central sacral pain or maybe both sides, you can treat both hip muscles and the QL for both sides. I'm going to show it on the right side. So the QL muscle, to access it, I'm going to bend my knee here. So this brings my leg down into adduction. I'm feeling a stretch right here on my glute minimus and glute medius muscle. Just in the stretch position like this, you might also feel that low back pain because we're basically bringing a stretch to the gluteus minimus and medius muscle. And the medius refers to the sacral area. The glute minimus, which lies directly below it, it has the same fiber direction. So we're stretching that one too. That one will commonly cause sciatic referral. So you'll feel pain down the back of the leg or the side of the leg. I'm going to get a pillow. So it's handy to have a pillow or bolster so you can support your neck. Oh, that's better. Okay, so if I just come with my thumb and I go right above the iliac crest and I'm directly on the side, directly laterally, if I push down to that area, there's like a gap. If I push forward, I feel the edge of the obliques. If I push backwards, I feel a hard edge of something right in between the 12th rib and the iliac crest of the pelvis. And that is the QL muscle. So you might feel some tenderness there. A lot of times it just feels like a hard thing, like you don't even, maybe you can recognize it as being a muscle. But you can feel it activate. If I lift my leg up, the QL muscle is going to fire. It's going to contract and engage to stabilize the lumbar spine and pelvis. I know I'm on the right thing if I have my thumb compression there and I feel the muscle engage as I lift my knee up off the ground. Okay, so you can get some initial compression on it. It's too small of an area to get compression with a ball. So I'll just use my thumb and then I'll just do some cross fibering, and I can feel as I push backwards and strum across the muscle, there's a hard bundle of fibers right there. And if I actually press down into it, really close to the attachment at the 12th rib, I can actually generate SI joint referral. I feel it like it's in my SI joint. I feel like a little ache, right? So you might generate that referral, you might not. So then once I get some gentle compression on it, I'm just going to give it feedback. So I just give it some light compression as I actively contract the muscle and relax the muscle. Can do that 3 or 4 times. And then we're going to do a contract, relax, stretch for it. So if I just hold my knee up like this, then this is engaged as well as the glutes. I'm going to hold that for 5 to 7 seconds with an inhale. And then I'm going to exhale. I'm going to let the knee drop down. Then I'm actually going to bring my leg back as far as it'll go so that I really keep it in line if I can with my torso. If you come forward, that's going to take some of the stretch off of the more anterior fibers of glute medius. So I'm going to keep it back. And then I can also hold it down with my other foot. So now I'm getting a good big stretch here. I actually feel some SI joint discomfort. And then I can also add some more side flexion just by bringing my arm up over my head. Now I'm feeling a stretch here in the QL muscle. And then I can even rotate a little bit, because as I rotate my torso, that's going to change the exact fibers that are getting a stretch. And I feel a really good stretch as I rotate just a few degrees forward. So that's a nice way of treating trigger points in the QL muscle. If I have a vibration tool, I can do all that with the added vibration. And that'll even enhance the therapeutics even more. Turn on this gun here. So I can do the active motion with the vibration instead of where I had my thumb. I can just use that as distraction, neurological distraction. And then I'm going to hold the leg up, hold for 5 seconds with an inhale. That's contract. Hold that contraction. And exhale, I'm going to let it relax. Let the leg come down to the mat. Lock over with my other
leg to keep it down. And then I can come into the stretch. So this is a stretch position. And then if I can get my other arm over there, yeah, like that, then I can even come into a further stretch, increasing the side flexion. So that's a great way of treating it. If you're working with someone else, you can have them do all this and you can provide the vibration or compression. Now I'll show how to treat the glute fibers. If I'm treating my right side, I'm going to come with some ball compression first. I'm going to treat the glute minimus and medius. So I start a little anterior. Here's my iliac crest. Here's the greater trochanter of my femur. And I'm going to come in between those 2 points. I'm going to start not totally laterally, not on the side. I'm going to start a little bit more forward so I can get all the fibers of the glute minimus and medius. And then I'm in this position. And now I can slowly cross fiber that muscle, the glute medius and the glute minimus, those 2 muscles, with slow cross fibering. So I'm just moving the ball slightly. I'm moving my body slightly against the ball. So these muscles all are a fan shape coming from the greater trochanter to the iliac crest like this, going all the way back towards the sacrum. So if I cross fiber this way, I'm going to be slowly going across those fibers at about 90 degrees. And that's how you can find taut trigger point fibers. So I'm on, you can see the ball right there, it is. I start more anterior. And this anterior area, I'm getting some of that SI joint pain. I'm on a hard fiber. So you want to just look for where there's hardness or tenderness where you're palpating. And then if it's really intense, you just take your body weight off. Use your shoulders, push up a little bit. And then I'll take the body weight off. And then if you want more compression, all you do is let yourself sink down lower. Bring more body weight onto the ball. So I'll just hold a spot for 3 or 4 breaths. So it's like I'm sinking my body weight downwards and I'm bringing a stretch to those fibers, just letting them stretch across the ball. You don't want to be too aggressive. You only want it to feel moderate tenderness. On a scale of 1 to 10, like a 4 or 5. You want to be able to stay relaxed while you do it. Now I'm going to move so that the ball is more directly lateral. Do the same thing. I'm going to cross fiber a little bit till I'm on something hard or tender. And there I found something. And this actually, when I'm right on it and I bring enough weight, this actually refers down the lateral side of my leg. I feel it mostly in the lower leg, in the ankle, the outside of the ankle. That's part of that sciatic referral pattern from glute minimus. Then I'm just going to cross fiber again and more of the posterior fibers. So now the ball's close to my sacrum. And there's another good spot. This refers into my glute max area and also down the back of the leg. So that's glute minimus referral. And now I'm going to move up one more spot. If I take the ball up a little bit higher, this is my iliac crest here. If I take it about 1 inch below the iliac crest, very close to the sacrum, right about here, that's a great spot. The glute medius trigger points are usually about 1 inch below the iliac crest. So I'm going to palpate that by cross fibering, and I found a good spot right there. Sink into it. Now the same move that I did with the QL muscle, I'm going to do for those hip muscles that I just compressed. So I'm going to get back into this position and I'm going to get my vibration good. If you have a vibration tool, use it. If you don't, just do the contract, relax, stretch. It still works. Vibration just adds a little bit more because you're adding another neurological input. So now I'm going to come in for an adduction stretch, basically. And I'm also going to be getting the QL again. I'm going to jump back and forth between the two. So I'm going to lift my leg up, hold for 5 seconds. I'll turn on the vibration tool. And then exhale, let the leg relax down, bring it back so it's in line with my torso, hook my foot over, and now I'm going to get vibration on the hip muscles, on the glute minimus and medius. I'm going to change my position so it's a little bit more ergonomic. Here we go. And I'm just going to let my muscles relax as I provide the vibration. So this helps the trigger point fibers, as they're going into stretch, they're going to resist stretch unless there's some type of neurological distraction. Contract, relax, stretch will provide some of that, but also you can enhance it even more with vibration. So that's what I'm doing here. And then I'm going to come up and treat the quadratus lumborum again. Okay, so that's done. Now I'm going to come into a final cross-legged stretch. Probably easiest is just to do a sukhasana pose, but I don't want it really tight like this. I want it actually very loose, or I want the lower leg to be about 90 degrees with the upper leg, with the thigh. That way, as I fold forward, that's going to bring more external rotation to the glutes and going to bring more stretch to the glutes. I'm also going to be folding forward, and that is going to bring stretch to the QL with that forward flexion. So this is another way of getting some different fibers from the QL muscle and treating that. So if I'm just doing it without vibration, I'm just going to lift my leg up. So the right leg, if I'm treating the right side, I want the right leg to be in front. So I have more external rotation in this hip, and the left leg is going to be getting some stretch too, but this one is going to get more. Okay. So this is the one that I'm targeting. So this is the one that's going to be forward. And now if I just bring my forearms forward like this, and then push my knees into my forearms, that is medial rotation of the femurs. And you can feel it when you do that. You're going to feel the glutes engage. So I'm going to do that and hold for 5 seconds. I'm also going to arch my back. That's contracting the quadratus lumborum and also the spinal erectors. I take an inhale, hold for 5 seconds. And exhale, relax. Then I'm going to start to fold forward. And I got a really nice stretch there, and I actually felt some referral into my sacrum, especially as I increased the flexion in my back, in my low back. So that's QL referring into the sacral area, into the SI joint. I'm also in this position putting a big stretch on the glute minimus and medius. So that's doing it with just contract, relax. Now you can enhance it with some vibration if you do it contract, relax, and then follow it with the stretch on the stretch phase, getting the vibration on the glutes and the QL muscle in the low back. So I'm going to do that. So I lift up, hold, arch my back, inhale. Exhale, relax. Let myself fold forward. Feeling some stretch on the glutes already. And now I'm going to add the vibration. So I went a lot further that time, getting more stretch, and that's going to release more trigger point fibers in the glutes and the QL. I'm going to come down again and also target the QL. So I bring the gun up above my hips to the right of the spine and get some vibration just above the iliac crest in that QL muscle. So I'm going to do this one more time. I engage the glutes with the medial rotation, arch my back, inhale and hold. And exhale, relax. Let myself fold forward. Make sure My front leg is going to be, at 90 degrees basically. So I get a lot of external rotation. Then I fold forward and I bring the vibration above the pelvis into the low back area. You can also bounce back and forth between the glutes and the low back. So that is a great way. Of treating quickly trigger points in the glutes, in the glute medius, the glute minimus, and in the quadratus lumborum, the QL muscle, and glute medius and glute medius and the quadratus lumborum refer directly to the SI joint. This is a great way of relieving that pain. And you're also incidentally getting work on the glute minimus as well, and that will cause sciatic referral. So you can treat both of those issues, low back pain, sacral pain, SI joint area pain, and sciatic pain down the leg with this same short routine. So I hope that helped you out. I hope you give it a shot. If you're a yoga teacher or other exercise professional, you're working with clients, you can do all this with them. You can show them how to do this themselves, and you can also help them out by providing the vibration as well.
SI joint pain baffles most medical practitioners because the pain source is not the joint, as is usually assumed. This has been shown to be incorrect by the medical studies of the joint. The truth is that most SI joint pain and dysfunction is caused by trigger points in the stabilizing muscles of the lumbar spine and pelvis, the quadratus lumborum, and the glutes. And the great news is, since the pain sources are muscular, you can treat them yourself with our methods. To learn more, click on the link in the video description. Thanks for watching.